Greetings and welcome back to another episode of Digital Dating with Anonymous Andrew. And I am really excited about this episode. This episode is going to cover a topic that I can't believe I have not covered since day one. And you would think, with the backstory of my podcast and how the podcast got started and the relationship that I came from, that it would have been probably one of the priorities that I would have definitely wanted to cover, but I did not. And what am I talking about? I am talking about STIs or STDs, sexually transmitted diseases or infections. And my guest today is Robert Johnson. And Robert Johnson is the president of a telemedicine company that deals with STDs. And I'm going to leave it there and welcome Robert first. Welcome. Say hello.
Thank you. Hello.
And tell us, Robert, what it is that you do. And we're going to get into this because I'm really interested about this.
Well, thank you, Andrew. So, I have been consensually non-monogamous. I've been married for 20 years, but we've been consensually non-monogamous basically that entire time. And I don't know that I'm huge into labels, but some people would call it swinging. Some people would call it polyamory, but whatever. Everybody's knows what everybody's doing and everybody's above board. And I thought I had been really progressive on the idea of making sure that I was being responsible for my partner's health by getting a complete STI exam, every 6 months. And I had never had a symptom, nothing like that. And I was just spending my own money. And sometimes I would get tested in urgent care, sometimes by my primary care physician. And this last time I got tested by an online testing company. But I had just found out that I was, STI free, including gonorrhea, when a partner texted me and said, "Hey, I think that you have given me gonorrhea because although I don't have any symptoms, my husband is absolutely having symptoms and he's in terrible condition." And he just went to the doctor and the doctor said, "You have gonorrhea and all signs, Robert, point back to you." And I was really surprised by that for two reasons. One was I felt absolutely fine, and I had no idea you could have gonorrhea and not have any symptoms. But the other one was I was staring at a completely, gonorrhea free STI panel that I had just had. And so I showed that to her. And of course, I was very kind. I wasn't like, "Hey, you're lying," that sort of thing. I was very kind. And she said, "Well, have you ever been throat swab tested?" And that was the first time in my life, Andrew, that I had ever heard that phrase, throat swab testing for gonorrhea. And as I said, I had been getting STI tested every 6 months for basically 20 years at that point. And then the really crazy thing happened, which was I had to go to three different doctors until I found one who knew what that was. One of them said he knew what it was, but he had never done it. And so therefore he was uncomfortable doing it and he wasn't going to do it. And the other one ordered it for me, but then the phlebotomist down at the lab in the basement of this building, who wasn't a young woman, she said she didn't know what it was and she didn't know how to do it and she wasn't going to do it. And then the third doctor finally did it. And sure enough, I had a completely asymptomatic case of oral gonorrhea. And that really pissed me off, for lack of a better word, because, I had thought I'd been doing the right thing this whole time. And when I found out that gonorrhea and chlamydia too, quite frankly, are site specific bacterial infections, meaning you have to test the areas of the body in which you might have them. And for those of us that have oral sex, then the throat is one of those locations. So you can have your genitals tested time and time and time and time and time again. And it's not necessarily going to tell you if you have an infection anywhere else. And so I spent the next couple of years, Andrew, trying to get other companies to do this. I have emails that I've sent to companies and things like that. Nobody would do it. And so I decided to create Shameless Care myself to address this very issue. And we do other things like medications and things, which we might talk about later, we might not. But the main thing that we do is really just try to educate people about this issue because doctors really don't know a lot about STIs. And I have found that even more so since working with doctors now every day. That just because someone's a physician doesn't necessarily mean that they know a lot about STIs. And so that's the origin story of the company. And so we're just all about, hey, sex is fun. Have as much sex as you want. I think it's a wonderful part of being human. But when you do go to get STI tested, just make sure that you're taking this proactive and progressive stance of realizing that STIs are just an infection and a list of infections. So it's not like a COVID test where you go and get a COVID test and you get tested for the COVID because it's a singular thing. What an STI panel is a list of various infections And what that doctor checks you for could be, God knows what. But what the next doctor tests you for could be completely different.
Completely different, which is what's happened to me. So I've gone in. So I've obviously been very sexually active my entire life, and I can think of 3 times, and I'm probably missing a few, that I have had contracted an STI. Well, and let's get that out of the way. Is it STI or STD, or they're both?
I think the new way saying it is STI, and it's a little bit of political correctness. I don't know. People kind of shy away from sexually transmitted disease. But my personal opinion on it, Andrew, is that if you can't handle the phrase sexually transmitted disease, if that hurts your feelings, then you probably shouldn't be having casual sex to begin with, because I just think that's being a little oversensitive. I tend to use STI now just because I'm in the habit of it, but STD is probably still the more commonly used phrase. And when we do things like advertise on Google, we certainly do STD because that is what the vast majority of people are testing.
People search for. Yeah, yeah, yeah. All right. My very first one was, my goodness, when I was 25 years old. I, like you, got a phone call saying you have chlamydia. And I was like, what are you talking? I didn't even know. I couldn't even pronounce that. What are you like? I was so naive at that point, at that time in my life. And this other person was experiencing symptoms and went to the doctor and then said, you gave that to me because I was not with anybody else. So I found out that way. And I think a lot of people do find out that they have something that way, because if you're asymptomatic or have no symptoms whatsoever, but you did pass it along to your partner or a partner, and they either pass on, like you said, in your case, they pass it on to their partner, and you do the trace back. I remember when COVID came out, when I got my first COVID and I had to report to, I think it was New York State, they wanted to know how many people I was in contact with. So do they still do that? If you report an STI to any medical facility, do they do a trace?
That's a great question. So there is something called mandatory reporting of certain STIs, and that's been a public health law for maybe about 100 years or so. It's not all STIs, it's some gonorrhea, chlamydia, HIV, syphilis. It varies a little bit based upon the local jurisdiction, but those are the ones that, generally speaking, there is mandatory reporting of. And by mandatory reporting, I mean in the physician who ordered the test and the lab who did the test report has to report that private health information to those local public health authorities. So, for example, Andrew, if you were to test positive for gonorrhea in whatever county you live in, your name, your address, your race, all of this sort of stuff would be reported to the local county health department. Now, in most cases, there's no contact tracing. In fact, I don't know of any jurisdiction where there's contact tracing. What they really want to know is they want to know the statistics, and that's where things like race and that sort of thing come into play. They want to know, like, if syphilis is exploding in a county, A, they want to know that syphilis is exploding. B, they want to know in what population. Is it men who have sex with men? Is it men who have sex with women? Is it African Americans? Is it white folks? Is it Latinos? That sort of thing. And then I think most importantly, they want to make sure that the loop has been closed on that. So on most mandatory reporting forms that I've seen, the physician has to indicate the treatment and that the patient was treated and that sort of thing. So I don't know of any situations where people are like calling people's boyfriends and girlfriends and that sort of deal. Maybe that happens. I don't think so. It's more about statistics and then just making sure that this person isn't still running around the community spreading Hep B or something like that.
Except that you mentioned having the loop closed. So, but if they close a loop on me, but let's say that I went to a party that, let's say I was into polyamory or monogamy, non-monogamy, and I passed it along to 5 people last weekend. And within a week, they may have passed it on to 5 more people. That loop is not closed. So I think, not that I want tracing to be done, because I think but you see what I sit on the fence on that one. I think, is it up to me to make that phone call to my partners and not the county, or how does that work?
Well, I think it is up to you. And I don't know and I'm not an expert on this area of it. So, like, for example, some county health departments will get an STI report and they do basically nothing with it. they probably send it on to the CDC and it's a statistical point, excuse me. Others are a little bit more aggressive where like we might get a call from a health department and say, "Hey, this patient tested positive for gonorrhea, but the doctor didn't put in the treatment on the form," for example. Like, how was that patient treated? And they're a little bit more proactive. I think people have to realize how common these things are. You talked about chlamydia earlier. About 5% of sexually active young women in the United States right now have chlamydia. I didn't
Mhm.
say had, I said have. And so you can imagine that if they're asymptomatic and 70% of them are, they're only going to find that out at their pap smear, probably. And so that's every 2 years for a young woman, generally speaking. And then, a large percentage of them are going to find out they have chlamydia. It seems fairly impractical that they're going to be able to contact trace all of those lovers that that young woman might have had, even if, in fact, that was their policy. I don't know that it's realistic.
When I was diagnosed with chlamydia, so I mentioned back when I was 25, somebody came to me and said that I gave it to them, and I know where I got it from. I was with a sex worker, and she gave it to me, and of course, I was obviously not using a condom at the time, and then I gave it to some I'm not gonna I yeah, I'm not gonna name names, obviously, or even affiliations, but I gave it to somebody who then came back, and that's when they told me that I had it. When I went to my doctor and he confirmed it with the test, and ironically, my father was a doctor who knew this doctor, and I said to him, I don't want my father knowing about this. How can we prevent this from getting spread to there?" And he said, "I'm gonna put down in your chart that you have honeymoonitis." And I had just come back from my honeymoon. So I don't think he recorded that I was positive for chlamydia. I think he wrote something else. And I wonder how much that goes on because there's shame. And maybe we should talk about that for a second. There are doctors out there that may or may not write down the actual diagnosis of it because that doctor did not write down that I had chlamydia. He said to me, "I'm going to put down a different diagnosis so it will not get back to your father." Anything to say about that?
Yeah, well, first of all, that's a fantastic story. Honeymoon-itis. I don't think I'll ever forget that. That's fantastic. It's a different
And
ballgame
that
now.
exists because I said, "What is honeymoonitis?" And he said, I forget why am I crazy? Honeymoonitis is that apparently couples get it is when they actually have too much sex that their organs get inflamed or something. And they actually termed it. And this was back in 1985 or something. So, but is it something that you've heard of that doctors do not actually write down the diagnosis?
It's not anything that I've heard of, but it may very well happen. But, we have HIPAA now, and the laws around privacy and public health information are very strict. It's one of the main things that we have to focus on every single day is HIPAA. So, we have a lot of patients who live in rural areas where, they know everybody at the local county health department, and they definitely do not want their information going to that local public health department. But there's just nothing you can do unless somebody is just never going to be tested for STIs, which doesn't seem like a very responsible thing to do or a realistic thing to do. Then you have to realize that people who are medical professionals are going to have access to that information. Once it hits the local public health department, the data is anonymized. I can't believe I pronounced that correctly. I was a little worried there leading into that word. And so when it goes on to the CDC and becomes a statistical point, things like that, it's your data is removed from it. So it's not something that I think people should really worry about. Believe me, if you talk to any health professional in the United States, HIPAA is something that they have to focus on every single day. And I think people are really respectful of that.
I grew up in the HIV era when it was first came on the scene. I was in the prime of my I think it was when did that come on? In the mid '80s when
Yeah,
when it
early
was
1980s. Yeah.
and that was when I was in my 20s and late 20s and when I was my most sexually active was between that's prior marriage, during marriage, and I had a short marriage, so it was like right after marriage. Very active, very sexually active, and I remember that the homosexual community was dropping dead left and right because those are the ones that were getting it. But it slowly creeped into the heterosexual community, and we were warned that you need to get tested and you need to, obviously take wear protection and yada yada. And I think if I'm not mistaken, they did do contact tracing for HIV. Was that, am I correct with that? Do you know that?
That predates my involvement, not in life,
Okay.
but in the healthcare world for sure. Yeah, so I'm not sure about that.
Because that was a huge, for the people who went through COVID, HIV was 10 times as bad if you were sexually active. I know many, many people died from COVID in a short period of time, but over the years, HIV killed millions of people across the world. And I think people have forgotten about that. But anyway, we're getting way off topic. But I just remember living through HIV. Now, it's funny that literally yesterday, I saw a commercial where you can take a pill a day and it's gone. Like you're cured from it. It doesn't come up or it doesn't detect in your system.
Yes, people can get treatment and in many cases make an undetectable level of the virus, meaning they can't spread it or will die
Correct.
from it, and that's fantastic. What a wonderful age we live in. And then of course there's PrEP, which is where you take antiviral medication preventatively, which makes it 99% reduces the transmission rate of HIV by 99%, which is just marvelous. For people who do engage in unprotected anal sex, PrEP is something that they should absolutely talk to their physician about.
Is that almost like a vaccine, or is it the prep is that I take it and I can't pass it to you if I contract it? Is that
It prevents contracting it in the first place. So right
okay?
now the treatments are I know for sure there's a once daily tablet, once daily pill. And then I think they're also about to release or maybe already have, I must admit I'm not an expert on PrEP, injectables which last longer as well. But yeah, we live in an age where if someone has HIV, it's fairly treatable. And if they don't have it, they can take medication to prevent it. And so it's just something we couldn't have imagined, those of us that were alive in the 1980s. This is magnificent.
Yeah, it was very scary. Very, very, very scary. I'd like to talk about another one that I think is very prevalent today, and it hit the circuit. Well, it's been around forever, but I remember hearing it more and more in the past 10, 15 years is HPV or genital warts. And that is extremely common, especially among teenagers, I believe. And I'm hearing that it's very common in the senior community. Have you heard? What do you know about HPV and genital warts?
So there are about 200 different strains of human papillomavirus. It's incredibly virulent, meaning it's basically unavoidable for people who are sexually active. I've heard people call it the common cold of the sexual world. I've heard
Hmm.
it called the glitter of the sexual world, meaning it just kind of goes everywhere. There's a couple of things about HPV which I think will blow your listeners' mind, Andrew. One of which is it's been shown to remain active for up to a week after being on a dry surface. So when you think about things like bed sheets, all sorts of different things, and that's just completely different than like an HIV or HSV, these sorts of things, which basically die immediately when outside of the human body. There's also a study out there that shows that it remained active on a sex toy that had been cleaned with alcohol. They detected HPV on the sex toy 24 hours later. So it's not only highly transmissible, it's also a very hardy virus, which is part of why it can spread skin to skin, is because, well, guess what? It can live on the skin for a good bit of time, and that makes it very hard to deal with. The CDC says that virtually everybody is going to be exposed to HPV in their lifetime. I've taken the approach personally as a sexually active person, which is that I very well may have HPV now. If not, I'm going to have it in the future. I may have it, 10, 20 times over the course of my life. Who knows? There really is no testing for it in men. Women are tested primarily during their pap smear, but something else that I think is important for people to understand is that HPV, like gonorrhea and chlamydia, now HPV is a virus, so it's not at all like gonorrhea and chlamydia, except that it is also site specific. So if a woman goes and gets her pap smear and she does not have HPV, it does not mean that she doesn't have it orally or that she doesn't have it anally. And so it becomes an infection that's almost impossible to avoid from like a testing standpoint. When men aren't getting tested at all, and when women are getting tested very kind of targeted just to their cervix, then, it's impossible to really kind of know what somebody's actual disease status is. But again, we were talking about HIV and we were talking about PrEP. Thank God for the HPV vaccine. I mean, cervical cancer rates have dropped by about 30% in the past couple of decades. Cervical cancer, many types of cervical cancer are caused by the human papillomavirus, as are esophageal cancer. I didn't say that correctly, but throat cancer essentially. And the HPV vaccine, which helps to prevent the most dangerous strains of HPV, because most of them, as far as we know, are harmless, but there are a few which have been proven to cause cancer. And those are the ones that are targeted in the vaccine, has really been a public health miracle. And almost every young person in the United States now is getting those vaccines. And I have to think, Andrew, that, when you and I are gone, whenever that is, several decades from now, hopefully, that these young people just won't even be bothered by these infections at all because they'll be protected from the most dangerous ones. And that's a fantastic vision for the future.
Absolutely. I would hope that at some point these are eradicated. But yet we haven't even touched upon some of the more common ones like herpes. Herpes A, B, and C, herpes simplex. You got the common herpes, which is the one you get on your lip, and then the genital herpes. You want to
Sure.
take this one?
That's an absolute fascinating topic. So there's HSV, herpes simplex virus, strain 1 and strain 2. And it used to be that HSV1 was what people had when they had cold sores. And if you had HSV2, you had genital herpes. It was just that black and white. And it's very hard to get people, even doctors, to move from that position, kind of that common knowledge position. But something fascinating has happened over the past couple of decades, Andrew, and that is when you and I were young, most kids, I dare say, got cold sores and they contracted that form of herpes from who knows, mom, grandma gave them a kiss when they were a baby. Who knows what? Grandma didn't know what the cold sore was and she kisses the baby and now the baby has cold sores for the rest of their life. Well, in reality, what they have is a type of herpes called herpes simplex virus 1. Now, that has decreased significantly over the past 30 years. So there's fewer young people being raised with herpes simplex virus 1 in the form of cold sores. What has happened as a consequence of that is that those young people are wide open to contracting HSV1 during oral sex as adults. And now HSV1 has become for young people, the predominant form of genital herpes. And so it's really kind of switched. And so HSV1 can be either orally or genitally. HSV2, same thing. And it used to be that HSV1 was oral herpes, but that script has kind of flipped in recent years because fewer people are being raised without herpes.
And let's be clear, and because I need to make sure, genital herpes and genital warts are not the same thing.
That is correct. Genital warts is genital HPV.
HPV. Okay. And you had mentioned earlier that there is no test for men, and while there may not be a blood test for men, and this was done to me several times when once again, I got that phone call from somebody who said, "You gave me genital warts." And I said, "I don't know how that's possible because when I looked down at my genitals, there were no warts." When I went to the doctor, they did the vinegar test. And I'm sure you're familiar with that, right?
I'm not familiar with that actually. No.
Oh, okay. So, and I'm going back 20 something years. And I went to a urologist. This wasn't just a regular doctor. I went to a urologist who specialized in this. And once again, this time I went to my father. I said, "Dad, I might have genital warts." I was a little older, a little bit more, and I don't think I was ashamed, and I really needed to figure this out. He sent me to a specialist, and this guy walked into the office, and it's the weirdest thing. When you walk into an office, I guess I understand how men walk in with ED and have to explain it to the doctor how embarrassing it is. I walk in there and say, "I think I have genital warts." It's embarrassing, but this doctor knew me through my dad. Anyway, pants come off, and he pulls out a bottle of vinegar and he comes over with a gauze pad and he wraps I can't believe I'm talking about this. He wraps my penis around this gauze pad saturated in vinegar. And he says, "I'll be back in 10 minutes." And he walks out and I'm laying on this table with this gauze pad wrapped around my penis with vinegar on it. And he comes back 10, 15 minutes later and turns the lights out and puts down that magnifying glass that doctors wear in their heads sometimes, and he looks down and He says, yeah, you got genital warts. They're only visible either, I think it's through a black light or some sort of some sort of light when when it's exposed to vinegar. And he showed me to that. And he said he showed me that you can do a home test. Oh, he says, although you really need a doctor to determine. And so I don't know. I'm not making this up. This happened to me. A real doctor doused my penis in vinegar and told me and diagnosed me with genital warts. So it can be detected on the penis, but it's not like the woman, where the woman's genital warts, I have been told, can look like cauliflower. Like they bloom and they're not pretty, and it's not a pretty sight. For the men, even though men can get the cauliflower looking warts, most of them go undetected, which is why it's so passed on so easily, because men just don't think they have it or don't know they have it.
Right. Yeah. And to be clear, most forms of HPV do not cause the warts at all. So, there's 200 strains, only a few cause warts, only a few cause cancer. Most of them, as far as we know right now, and when I say we, I just mean science. It's not like I'm studying this every day, are completely harmless. Now, it may be that in the future, it took a long time to find out that HPV was causing cervical cancer. For a long time, researchers thought that was herpes simplex virus. They thought there was a viral kind of root to it, but they didn't know exactly what. So it may be that in the future we find out more of these are also harmful. But so far as we know, most of them, you get them, and some people, their bodies clear them up and defeat them and get rid of them in a few months. For some other people, they last years. But most of them, so far as we know, are harmless.
Okay. Let's take. So I think we covered pretty much the common ones that are out there. I'm sure there's other STIs or STDs we haven't talked about. I'd like to learn more about your practice, your telemedicine company, what you do, what you offer, and what do you suggest. So to the audience who is sexually active, especially in the non-monogamy or polyamory world, what is your recommendation that they can adhere to for a healthy sexual lifestyle?
Okay. I'm just pulling up some tests here, Andrew, to make sure I don't leave anything out. So I think the main thing to understand is that there is no definition of a full panel. And even when people use terms like 9 panel, 10 panel, 11 panel, there's no defined terms for that. So people have to really think about what it is that they would like to be tested for and specifically ask for those tests from your physician. And in some cases, your doctor will be prepared to do those. And in some cases, they won't, or they won't know how, that sort of thing. But we actually have some cool resources at Shameless Care. So even for people who don't want to use us for their testing, we actually have a web page on our website where people can get a list of suggested tests to ask their doctor for. And there's even additional resources on there. For example, one of them is for a video from a physician that you can show your physician in the exam room. If your doctor says to you what my doctor said to me, which is basically like, I'd love to throat swab test you, Robert, but I don't know how. And so there's a 60-second video from an OBGYN on there where she says, hi, I'm Dr. Storr. And don't worry, throat swab testing for gonorrhea is super easy. It's the orange Aptima swab. You already have it in your exam room, and she just walks them through the whole thing in 60 seconds. So, to my mind, what people really need to be tested for is HIV, syphilis, Hep B, Hep C. These are hepatitis. Maybe I shouldn't have shortchanged them there. And then chlamydia orally, gonorrhea orally, chlamydia anally, and gonorrhea anally if people have any anal sexual contact at all. If you don't, then you can probably avoid those. And chlamydia genital, gonorrhea genital, and then two others that people generally don't think of, but are becoming even more prevalent. One of them is Trichomonas, which is a parasite, believe it or not. And it is the single most common curable STI in the United States. It's extremely, extremely common. And then another one called Mycoplasma genitalium, which is a little bacterium that was actually just detected in the 1980s. That's how small it is. It really took some advanced technology to even detect it. The interesting thing about all of these bacterial STIs, so let's stop and think about this for a minute, Andrew. You started off this conversation by talking about HIV. Now, the Centers for Disease Control says that the transmission rate of HIV for heterosexual, penis and vagina sex, so is 8 out of 10,000. In theory, Andrew, you could have sex with HIV positive women the rest of your life, and it would still be more probable than not that you would not contract HIV. Your risk would be 8 out of 10,000. Well, guess what, everybody? If you have one of these other STIs, like a mycoplasma genitalium, like an undetected gonorrhea infection, that sort of thing, that more than doubles and almost triples your risk because your tissue is inflamed, and that sort of thing. So that's one reason in particular to be checked for all of these sorts of kind of things, which are often thought of as ancillary because they are curable, but really do make a difference in your health.
Okay. I wanted to talk about the last two things that you mentioned. It was the one that was discovered in the 80s
Mycoplasma genitalium,
and the one before that.
Trichomonas.
Okay. I've never heard of those two. Can you
Sure, most
describe
people
them?
haven't. Trichomonas is a little parasite that lives in the reproductive system. And it looks really cool on a microscope. So if anybody out there wants to Google it, it's definitely horrifying. It's almost exactly what you would imagine. It's a little parasite that kind of sits there and eats your tissue. And yes, it is the single most common curable STI in the United States. So it's much more common than gonorrhea. It's much more common than chlamydia. It's something that, many of your listeners right now definitely have and causes a litany of health issues, but one of which is making you more susceptible to other STIs. And then Mycoplasma genitalium is a little bacteria, sometimes called MGen, and it is definitely an STI. It is spread through sex, and it's a little bacteria, which a lot of people who have what they think are recurrent UTIs and just keep going back to the doctor and getting, antibiotics for UTIs and things like that. What they should probably stop and ask their doctor is, hey, doctor, can we go ahead and get a test for Mycoplasma genitalium? Because it really is super common. And when people test for it at shamelesscare.com, when they test positive for it, they almost always have the same response that you did, Andrew, which is what the hell is that? I've never heard of that before.
Right. So let's go back to that. What are some of the symptoms of this tricho thing?
Yeah, so symptoms are really interesting because most people, and this is the crazy thing. So I'm always a little bit hesitant to tell people about symptoms because then they have a tendency to sit back and say, Robert said it feels like this. I'll know if I have it. The most common symptom of basically everything that we've talked about today, in particular these last two, are no symptoms at all. So, trichomonas in women, you can begin in some certain circumstances to have discharge and things like that. And if you go to your doctor and you talk about your discharge and that doctor sees it, they'll immediately know what's going on. But it's something that I feel like people need to be proactively tested for, in particular men, because men are giving it to women, because it is important that we just don't pass these things along to people that we care about and our friends and lovers and that sort of thing.
Big 80, $64,000 question, whatever they call that. I come out of a 3, 4, 5, 6 year relationship with somebody, male or female, but in my case, female. We maybe at the beginning showed each other our sex tests that we got from our doctors, which at the beginning of this episode we found out that are not accurate in 99% of the cases. When I am now going forward, let's say that I am now in the dating world. This is a dating podcast, and I want to inform my audience. So going forward, if you should get into a relationship with somebody and you choose to be monogamous and you choose to no longer use a condom, because that's how I operated. So in the beginning, we used condoms, my girlfriends and I, and then we would go out and get tested. And as the test came and we were satisfied, blah, 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 the condoms would go away and yada, yada. Your statement about those blood labs or the panels that I would get from my primary care physician that I would get, especially after the last relationship I left, where she cheated on me. I walked into my doctor and I said, Doc, I need a full panel. I want everything tested because this woman was an escort, blah, blah, blah. And he came back and thank God at the time, he said to me, you're clean, blah, blah, blah. But now I got to second guess that and wonder. So going forward, and for me and the audience, who do we go to? I mean, obviously we'd like to refer people to your clinic or to your telemedicine, but how do we ask for a full panel going forward so we can show this to our potential partners? Do you understand what I'm trying to get at here? Because I'm
Yeah,
stumbling.
Absolutely, I do. And I want to clarify something that you said. I didn't say that the tests people get from their doctor aren't accurate. They're extremely accurate. It's just in many cases, it's not
Incomplete.
thorough. Yeah,
Yeah, incomplete.
incomplete. And then that is a huge difference. So I think that, people are welcome to go to our website, and our testing is not inexpensive. It tests for 14 different sexually transmitted infections, and we don't accept insurance. So you put those two things together, it's not going to be like $29, right? And so people are free to go to our website and screenshot the tests that I'm recommending and then take it to your doctor. And you'll automatically have a much better chance of getting tested thoroughly than you would had you just walked in there and said, test me for anything, doc. And the doctor has its back to you as he's frantically typing on the computer, which is how these medical exams go these days in 2025, right? But I also think that if people go to a specialty sex clinic, particularly one for like the LGBTQ community, they're very on top of like throat swabs, anal swabs, things like that. They seem to be a little bit more progressive. And so even if you're a straight male and you feel comfortable and you want to go to one of those places, you're probably going to get a better test in terms of thoroughness than you would, from an urgent care or your primary care physician or that sort of thing. But I think the key here is to stand up for yourself, to walk in there with a list of tests. You can tell your doctor this, which is absolutely true. At shamelesscare.com, 80% of our gonorrhea cases are oral only, meaning every one of those people would have tested negative had we only tested their genitals in the way that most physicians do. They would have been in the exact same situation that I was in. They would have left that clinic and they would have harmed other people the same way that I did. And so you just have to be proactive. And again, I think this all comes back, Andrew, to just not thinking of STI tested as a thing, understanding that full panel is not a medical definition, and being prepared to ask for specific tests and specific locations is absolutely key.
Let me ask you this, because we started this conversation with your story that you were diagnosed with oral gonorrhea, but you didn't know that because somebody had come to you. Are there any symptoms of that? Is that something that can be that the body can cure itself, or is it something that can go undetected? So let's say that person never came to you and said that you gave it to me and I gave it to my husband. Would you have known at all at some point?
I don't think I ever would have known. And oral gonorrhea, it's a very peculiar. Just read a study about this the other day. The average length of duration is 16 weeks. So people do tend to quote unquote cure this on their own. You know what's really interesting about that, Andrew, is that it's also the only form of gonorrhea which requires a test of cure, meaning if your doctor finds out that you have oral gonorrhea and you go and get the intramuscular injection, which believe me, hurts like a son of a bitch. And, 2 or 3 weeks later, you have to go back and get retested only if you have oral gonorrhea, because it's actually harder to kill orally than it is genitally. If you have a genitally, they just assume it's gone. No reason to come back, just don't have sex for 2 weeks and then enjoy yourself. That sort of deal. So it's very peculiar, and I don't pretend to understand it. Why does the body eventually cure it on its own? Oftentimes within just, 4, 5, 6 months. But then also it's harder for the antibiotics to kill it if it's orally. Doesn't make tremendous sense to me, but
Doesn't make any sense. No.
that's exactly true.
Very interesting. Okay. I like the idea of going to your website and either taking a screenshot of the panels, because thankfully my doctor doesn't listen to my podcast. But I'm an alcoholic in recovery and a drug addict in recovery. And so ever since I entered in recovery, my doctor was the one that got me into recovery. He has said to me, we're going to test you for 6 months, every 6 months. So I see him every 6 months, and he tested me for HIV and all that I've been in over 10 years. But now what I'm listening to, he probably just I just trusted him just to test me for everything that I could have possibly maybe have contracted when I was out there being active, very sexually. When I was doing a lot of crack cocaine and a lot of alcohol and a lot of opiates, and there was no, I don't know what's the word I'm looking for. There was no, um, I fucked anything. Okay. I didn't, there was no, I can't think of the word, but so I'm just wondering, like some of the stuff that you have gone over here, it's like maybe, and not just me, but maybe somebody in the audience. So I think going. So, what's the name of your website again? Shameless.
Shamelesscare.com. And I do have something else that we haven't talked about, which I think is really, really cool. And that's called DoxyPep. And DoxyPep is kind of the new and latest thing. It's essentially where you take a single dose of the antibiotic doxycycline, just 200 milligrams, which is just a single dose. If someone was on doxycycline for some sort of serious infection, they might take like 14 times that much. But you take a single dose within 72 hours of sex, and it pretty dramatically lessens the likelihood of contracting gonorrhea, chlamydia, syphilis, and mycoplasma genitalium. So for syphilis and chlamydia, it's almost 100%. It's like about 90% chance, 90% less chance of contracting those infections. If your partner did happen to have those, of course. If they didn't, then your chance was zero to begin with. And then for gonorrhea and mycoplasma genitalium, it's more like 50%. And so that is probably our biggest seller at shamelesscare.com. It's very popular in the men who have sex with men community. But, quite frankly, I feel like anybody could benefit from it. I take it personally because I just feel like, hey, if this person does have chlamydia, for example, and she doesn't know it, then there's almost no chance I'm going to contract it. Then guess what? There's almost no chance I'm going to give it to the next person. And that just makes me feel better about the situation because I feel like we all have to work together on these things. The other thing that we haven't touched on, Anthony, is that most of these things spread by oral sex. So I think it's obvious we've been talking about throat swabs that gonorrhea and chlamydia do, but so does HPV, so does syphilis. And so if people out there use condoms in the same way that I do, and in the same way that probably almost everybody does, which is by the time you even reach for the condom, you've had, 15, 20 minutes of unprotected oral sex, then a lot of these things have spread by the time the condom even makes an appearance at the party. And so DoxyPep is one of those things that can definitely people can use to protect themselves. And it's very inexpensive and it's very safe. Doxycycline has been around since I believe the 1970s. It's very well tolerated and that sort of thing. And so that's really kind of a cool thing that I think people might want to be aware of. I really think that DoxyPep in the future is going to be something that people just think of when they think of safe sex in the same way that people often think of condoms today. Not that it's going to replace the condom, but the two kind of go hand in hand, in my opinion.
This may piss some people off, but it's almost like the morning after pill. It's like just take take that the next morning, and you're pretty sure that you're not going to be either pregnant or have an STI.
Yeah, absolutely. Absolutely. And at our company, what we do is we only supply people with a year supply because I just know that people often feel bad about a sexual situation. They want to address that sexual situation. They swear to God they're never going to do it again. And what do? The next weekend they do it again. And so we
I do
don't
it
want
again.
people going from one emergency to the other. But it takes a while to ship people medication. It comes from our pharmacy partner that's located in Kentucky. And so one of the things that we do for people is that when they order their medication, they can request an emergency dose, again, kind of like Plan B, I guess, but an emergency dose sent to their local pharmacy. So if somebody in, I don't know, Grundy Center, Iowa, for something like that, their condom breaks and they want DoxyPep, they can have a single dose sent to Grundy Center, Iowa. They'll have it, within an hour or two. And then guess what? Their year supply of medication will come in the mail a while later. And if they never use it, that's fine. After a year, they throw it in the trash. But if they need it, hey, at least they got it now for in the future.
I don't know if you might know the answer to this. So DoxyPep, is this something that I can go to my doctor and say, hey, I heard that if I have a supply of DoxyPep and take that the next day after a sexual encounter, can he write me a script, or is it something that's only available certain places?
Certainly can. Certainly can. I think it's going to depend upon if they're familiar with it and if they've heard
Okay.
of it. But doxycycline is incredibly inexpensive. I mean, for us, we charge $99 for a year's supply, but people have to understand that I'm paying the doctor and I'm paying for advertising and
Sure,
blah, blah,
sure,
blah.
sure.
If you go to your own doctor, particularly if you're going there anyway, you could probably get a year's supply of doxycycline for DoxyPep for, 15, $20 at Walgreens, that sort of thing. It's very inexpensive insurance. It was when the CDC released their guidance for it, they said that it was primarily for men who have sex with men. because they are, disproportionately affected by STIs. And in the mainstream media, it said that DoxyPep doesn't work for women, but that was a huge mistake. There was only one study on women, cisgendered women with DoxyPep, and that was done in Kenya. And at the end of that study, it did show a decrease in gonorrhea, chlamydia, and syphilis, but it was not statistically significant. However, when the researchers took hair samples from those women, they found out that most of the women who said they were taking DoxyPep had not taken it at all. They had no doxycycline in their system whatsoever. And it's an absolute shame that that study made the news, because I still hear from people all the time that DoxyPep does not work in
Does not work
cisgendered
for
women, but
women. Yeah.
that's just not true.
That's
There was another
misinformation.
study out of Japan where, sex workers were taking DoxyPep, and it was a complete home run in Japan. But guess what? They were actually taking the medication, and the women in Kenya just weren't.
Mm, interesting. Yeah, well, there's some things I could say about that, but I'm going to keep quiet. Robert, we have to wrap it up. Wow, what I learned today that I should have known for the past maybe 50 years, or let's say 40 years of my sexual improprieties of my lifestyle. But thank you. You really educated us on many things. And so we're going to send everybody to your website, which is shamelesscare.com, and they can look up more information, right?
Yes. Yeah, absolutely. And we have a podcast as well, the Shameless Care podcast. But yeah, shamelesscare.com, and you can write us a message there. And I just want to tell all of the listeners that this might be the most patient man in the world. It took me probably 15, 20 minutes to get my technology straightened out. And he was very kind and didn't make me feel bad about it at all, which is very appreciated.
No, well, my pleasure, Robert. And in reverse, I had to reschedule Robert from this morning. I thank him very much for being patient with me. So everybody go see Robert Johnson's website, shamelesscare.com, and his company, and learn more about STDs or STIs, which are more, I guess, what we should be calling them today. So all right, Robert, thank you so much for joining us today. It was very, very, very enlightening and educational.
It's my pleasure.
Okay.